Have you ever felt dizzy and wondered why? What if I told you that the root cause could be lurking right beneath your nose? In this video, I will shed light on one of the most overlooked causes of dizziness that's often dismissed by doctors, and that is neck issues. Today, I'll reveal 20 unexpected clues that might point to your neck as the culprit behind your dizziness episodes. Just a reminder, I'm not diagnosing anyone in this video, but simply speculating on 20 clues that might indicate the neck as a culprit of dizziness. Based on my own clinical experience, you might be surprised, but the neck can actually play a central role in contributing to dizziness and vertigo. It's often something many people wouldn't even consider, including doctors. But when patients come to me feeling like the world is spinning and the usual tests their doctor ordered don't show anything abnormal, that's when I start thinking, let's dig a little deeper into what their neck might be trying to tell us. Now, the first thing to consider is perhaps the most clear-cut sign of neck-related dizziness or vertigo, which is a history of trauma to your head or neck. This could be from an incident like a car accident or a sports injury that resulted in a concussion or whiplash. If you've ever felt that a sudden jolt where your head snapped forward and snapped backwards in a split second, it's worth considering that your current dizziness might actually trace back to that event. And surprisingly, episodes of dizziness or vertigo from neck whiplash may not even start until 10, 15, or even 20 years after the initial trauma. Let's talk about imaging results. Diagnosed neck pathology, which could show up on an X-ray, a CT scan, or a spinal MRI, might be another clue that your neck is part of the issue. If these images indicate abnormalities like degenerative changes in your neck or herniated discs, it could very well mean that your neck is trying to tell you it's contributing to your dizziness. The third commonly recognized sign of dizziness from the neck is neck pain. If you've got persistent neck pain, it could be contributing to dizziness or vertigo more than you'd think. You can almost imagine your neck screaming for attention through this pain. Linking that pain to the dizziness or spinning you feel might be the key to getting relief. Now, those are 3 commonly accepted signs of cervical dizziness in traditional medical care. We're now going to go over 17 more clues that your neck could be causing dizziness or vertigo that are not widely known or accepted. Now, as we move into some of these lesser known signs, ask yourself if turning your head to one side feels different compared to the other side. If there's a noticeable stiffness when turning to one side, that asymmetry in your neck mobility could be contributing to your dizziness or vertigo. Think of it like a rudder of a ship. If it doesn't turn well to one side, the whole vessel could have trouble steering straight. In my experience, people with asymmetrical stiffness in their neck, meaning more stiff turning one way than the other, have neck-related dizziness as one of the root causes in their case. And what about pain that radiates? Do you feel any uncomfortable twinges in your shoulder, your ear, or your jaw? That may be another clue that your dizziness or vertigo is originating from your neck, possibly also affecting your inner ear and the surrounding muscles that influence your proprioception and your overall balance and equilibrium. Speaking of the jaw, if your jaw clicks or deviates when you open wide, chew, or yawn, that could be another sign that your neck may be causing your dizziness. You see, it's all interconnected. Your jaw's alignment and function have a ripple effect on your neck and your head, potentially indicating that your neck is one of the root causes of dizziness. Another subtle but powerful clue is your sleeping habits. Are you sleeping propped up with extra pillows due to vertigo? Or perhaps finding your most comfortable sleeping position is on your stomach, face down, with your head turned really far to the side? These sleeping positions might actually be a clue that your neck is an underlying cause of your dizziness or vertigo. Let's consider postural habits. If your work or hobbies involve a lot of leaning forward, especially over a desk or a screen, your neck might be struggling to support that forward-leaning posture. Over time, this can strain your neck muscles, which, annoyingly enough, could be a culprit causing your dizzy spells. Have you been told by some healthcare provider that one of your legs is longer than the other? Do you have a leg length discrepancy? Do you suffer from low back pain that correlates with dizzy spells? Do you have a history of scoliosis? Or find yourself using improper ergonomics with electronic devices? All of these may sound random because they're so distant from your neck, but they can all interconnect. You see, misalignment anywhere in the orthopedic structure of your body can affect your neck's posture, which in turn can contribute to dizziness or vertigo. Even habits like watching TV in bed or reading in bed with your head in an awkward position can be significant. Reclining back comfortably may seem fine, but if it leads to improper support of your neck, these reclining positions and lounging positions may be a clue that your neck is part of the problem contributing to dizziness or vertigo. Press gently behind your earlobes. If that feels tender or uncomfortable right back there, your neck may be telling you that the upper cervical bones are out of alignment. So tenderness behind your earlobes is a clue that your neck may be contributing to dizziness. In tandem, if headaches start popping up around the base of your skull or squeezing around your head where it feels like you're wearing a tight swim cap, those all might be clues that your neck may be playing a role in your dizziness or vertigo. Have you noticed any ringing in your ears that might come and go, maybe even pulsating in your ears? Sometimes ringing in your ears or pulsating in your ears that comes and goes or changes with the position of your neck may be a clue that your neck is contributing to dizziness. Dizziness that flares up after doing a spin class or going on a long trip on your road bike where you're hunkered way forward in the trunk, but your head is still lifted up so that your eyes are level with the road. Dizzy spells after that kind of exercise may be related to your neck as well. Do you notice that your dizziness may ease off if you take anti-inflammatory medication such as ibuprofen? Any of these are clues and indicators that your neck may be the silent instigator of your dizziness or vertigo. You see, all these signs weave a complex but interconnected web from your neck to your dizziness. By understanding these different clues, you're taking a crucial step towards addressing the deepest root cause and not just masking your symptoms with medications. Massage therapists and physical therapists and chiropractors often encounter patients who, unbeknownst to themselves, have lingering neck tensions from daily habits and stress. You might even find that a gentle neck massage or certain physical therapy techniques offer surprising relief for dizziness or vertigo. This isn't just coincidental. It's targeting those tense neck muscles that can directly influence the nerve pathways that affect proprioception and balance. Now you might be thinking, what can I do on my own to start addressing this? Awareness is the first step, but actively correcting your posture throughout the day is essential too. Start with how you hold your head while texting or working on your phone or computer, and pay attention to these subtle forward head postures that can accumulate over time. Imagine a straight line from your ear through your shoulder and straight down to your hip. That's the alignment you're aiming for, whether you're sitting or standing. Exercises focused on strengthening the upper back muscles, stretching the chest muscles, and gently tucking the chin to align the ear over the shoulder can help correct that posture and alleviate some of the dizziness from the neck. Let's not forget that lifestyle adjustments can pack a major punch. There's a lot you can do on your own. Stress management techniques, whether that involves relaxation, belly breathing, listening to your favorite music, Laughing, calling a friend, or just taking time out in nature can relieve underlying neck tensions. The connection between mental stress and muscle tension is well documented, and by managing stress, you could simultaneously ease some of the pressure in your neck contributing to dizziness. This journey may seem complex, but remember, you're not alone, and there are pathways you can take to make a positive difference in your life.